Thank you. Sorry, I was reminding everyone tonight that they should have the microphones on, and I'm the one not speaking with a microphone. We need a mic so the recording folks can hear the recording. So I was saying we were so excited to bring you together. We are still excited to bring you together. We do have a packed agenda. We would love to start with introductions and have a chance for all of you to know one another. But before, I would like to start with addressing some of the happenings from today. I'm not sure how many of you follow media. It has been in the media. Unfortunately, the morning started with a pretty significant tragic incident at the Motel 6 in Issaquah. There was a shooting this morning. 2 people were shot. Fortunately, they are not dead. They are in the hospital. However, I wanted to bring that up to you because most of you know we've been really working closely with Motel 6 for now a couple of years. The staff that have been injured, they are staff. We work closely with them, so it hits pretty close. And you also know we've been partnering with Motel 6 during severe weather, sheltering for folks who are unhoused. We are also preparing to launch an emergency housing pilot program there. So just wanted to let you know in case wanted to hear it from us. If you didn't hear it via news, also just recognize and please keep those families in your prayers and in your thoughts as we'll know more. Fortunately, the shooter was found, so it's I guess the incident ended as good as this incident could, but it's definitely hits close to the community and to all of us working with Motel 6. So wanted to mention that at the beginning. We'll update you on our progress and continued collaboration with Motel 6 for sure. They've been really good partners with us, but that's it for now. So with that, would love to give you a chance to introduce one another. Maybe we can start at this side of the room. Just a few technical reminders. As you speak, please turn the microphones on. There's a button on your mic. You just press it when you see the red light. That means your mic is on. There you go, Maury. And then once you finish speaking, just turn it back off so then we don't get feedback from one another. So if you want, please start with your name, what board or commission you are from, and there's just one thing that you feel comfortable sharing about yourself, one interesting thing that you would like your fellow board or commissioners to know about you. So thank you. With that, let's go ahead.
Okay, Monica. Maury Edwards, pronouns are he, him, and I'm on the Human Services Commission. I am an alternate. Would love to be full-time. Let's see, something about myself. I live here in Issaquah. I live up at Providence Point. They didn't check my ID to see if I was old enough, but somehow I got in. And I love being here. I love the city of Issaquah. I've lived in Issaquah since '85.
Hello, everyone. My name is Tony Curry. I'm on the Equity Board. Let's see, a fun fact, pronouns, he, him. Fun fact about me, if you see me around Issaquah, I live in the Highlands, but I come down to down here all the time. I always have a smoothie in hand. I love smoothies. I could just drink smoothies all day long. So, fun fact about me.
Buenas noches todos. My name is Lucrecia Choto, and I am on the Equity Board. And my pronouns are she, her, and ella. Ella meaning she in Spanish. And something interesting about me most recently is that I've taken up mountain biking. And I had quite a spill earlier this week, but I'm very excited to be back on the trails in a different way because I'm also an avid hiker.
Hi, I'm Alina Pan. I intern for the Human Services Commission, and I'm a high school and junior, so I'll be taking minutes today.
I'm Trish Bloor. I'm the chair, as you guys know, of the Human Services Commission. I love Issaquah. I've been involved in the community since the late 80s. When I moved here in 87, I believe. Kids went to school here, and okay, what's a fun fact about me? I just flew in from New York City, and wow, I hadn't been there in a long time. So, yeah.
Good evening. My name is Jaime Fajardo. Pronouns are he and him. I feel like I'm at the court system again because I work for Superior Court, so I'm always with a mic. This is normal for me. I would say fun fact for me, I really need to say a fun fact, but I just started coaching little girls team, first graders, and I have Miss Marisol's kid on my team, and it's been super fun to contribute. It was interesting too because most of the team was half of them were Latinas, and it was kind of cool to see the bilingual go back and forth and trying to help. And you just see the little girls kind of plant seeds. And when we talk about equity, we talk about representation, right? And so it kind of hit home as I was kind of doing it, and because I played ball growing up, and I didn't realize how much joy I'd get little girls first grade. So I don't want to say it's a fun fact, but I'm going to continue that work, and just seeing the little girls kind of grow on their way is something that's been, I want to say missing, but it definitely made me more complete in my way. So, and a way too to contribute to the city of Issaquah. I've been here for, I would say, since 2008-9 in the city of Issaquah on the equity board, the Human Services Board, and as I was kind of perplexed, I was like, how do I contribute back into this place? I've been living here for the past 10 years, and so I'm grateful to be sharing this space with all of you. So.
Hi, good evening, everybody. Ray Manahan, he, him. I'm part of the Equity Board. And fun fact about me, I love running. I try to do one marathon a year, and I just picked my next one. So we usually try to go somewhere different. So we're going to go to New Hampshire. I love the running around in this beautiful area. I'm not good at trail running. I just started that last summer, and I want to do it again. So hopefully I can catch up to you.
Good evening. My name is Preeti Modi Pan. I use she, her pronouns, and I'm on the Equity Board. And I guess the fun fact about me is my daughter is sitting right across the table and taking minutes for this meeting.
I'm Madeline Fish. I'm an alternate on the Human Services Commission. A fun fact about me is I love hiking, especially the trails on Squawk and Tiger. Cougar's okay, but really Squawk and Tiger are my faves right now.
Hello, I'm Manuel Brown. I am on the Human Services Commission, and I've lived in Issaquah for about 28 years now. And I'm done wrestling coaching at the high school and middle school, both at IMS and Issaquah High, and I'm a woodworker, so that's what I do.
Continue up here. Okay, so Pat, want to go next?
Pat, we can have you introduce next.
Sure. Hi, everyone. I'm Pat Sarangachu, and I've lived in and around Seattle for the past 20 years or so, but in Issaquah for more than 10 years. Something about myself, I am originally from Cameroon. My first language is French, and I love to travel. It's really good seeing the other Equity Commission here with us. Thank you.
Okay, I don't know everybody's names up there, so whoever wants to talk next.
I'll jump in. My name is Shay Fleming. I'm actually the chair for the Issaquah Equity Board. I apologize that I'm not there with you all tonight. However, my pronouns are she, her. And a fun fact about me is that I actually probably know most of you by your pets because I work with all the veterinarians from here to Blaine.
Okay, how about Chris?
Trish, I'm happy to help. I think
Okay.
Chris is not part of the board. However, we have Elisa as part of the board. And Elisa, please introduce yourself.
Sure. My name is Elisa Stewart, and I'm part of the Equity Board. Fun fact about me is that in 2018, I lived in New Jersey. 2019, I moved to Pennsylvania. And 2020, I moved to Washington State. And I'm not moving anymore. And so everybody stuck with me. Thank you.
And I think that's all for all boards and commissioners. We do have guests and public who may do public comments, but yeah, yes.
Okay, great. Okay, so
Yes, we do.
okay. I'm going to let Hannah take over there.
Sorry, not quite Hannah yet. If you are okay, we would like to do public comments next. Is that okay?
Right. I thought I was going to ask Hannah if she wanted to, if you
Oh.
have a list of who's going to do public comments.
We don't have a list, but we have folks from the public here. So they did not sign up in advance, but we have them here. So I'm going to just check in with them if that's okay with you really quick. So I'm going to start with folks online first. I do see someone named Chris, and I also see Paul Wally. Welcome, both of you. Are you interested in making public comments?
No public comments. This is Chris. I'm just listening in. Thank you.
Okay, thank you so much for listening in. How about you, Paul? Good evening. So nice to see you.
Good evening. So nice to see everyone on the Equity Board, and I'm also just listening in and trying to support.
Oh, thank you both for being here. And then we have our friends from the Baha'is of Issaquah here. Welcome. Would you like to make a comment?
No, I'm fine.
No, just here? Okay, that's great. So we do have a few public community members, but no public comments, so that's great. And the rest are presenters. I vouch for them. I know them. While I'm trying to pull up the PowerPoint presentation, I see that Pat has a question online.
I don't know if it's only me, but I can't hear anyone else but you, Monica.
It's not just you. I couldn't hear either.
You couldn't hear the other board members when they introduced?
They introduced, I could, but when there's conversation, I can't.
So thank you for that. Yes, that's a good reminder. You can only hear us when we have the microphones on. So right now, nobody's speaking. I just made an awkward moment of silence as I was trying to present the slideshow. But that's a very good reminder for all of you to turn on your mics when you speak. Otherwise, those who are in attendance online cannot hear us. Okay, and with that, I'm gonna hand it over to Thomas now.
Great, thanks, Monica. Can you all hear me online? Great, thanks.
Yes.
Yeah, so my name is Thomas Valdrez. I'm the city's senior transportation planner. My pronouns are he, him. And today I would just like to introduce the transit study that we're doing. Just providing an introduction right now and hoping to come back to you all at a future date. So next slide, please. Oh yeah, great. Yeah, perfect. So again, really just providing a background on what we're doing today, providing an introduction on the scope of work, and then talking about potential options for the Human Services Commission and Equity Board to provide your stamp to make sure that equity is at the heart of this, and just providing some next steps and ways that the community can get involved in this study. So as you all know, the community has been growing a lot in the last 20 years. The census estimates that the population has more than doubled in 20 years. And so in advance of this growth that we've had, and in anticipation of future growth that we're expected to have in the next 20 years. We're really trying to have a more proactive approach with how we are going about our growth, and we feel that transit can be a really great player and be at the heart of a lot of this growth to make sure that people are able to get around in an effective way, and that it's a cheap and affordable way to get around. And so in short, we're hoping that by getting in front of future updates to transit in the next 20 years with light rail coming, as well as the more short-term effects of transit that will be updated in that 20-year time span, we're hoping to get in front of it and make sure that we have equity at the heart of it, making sure that we can balance our community's values with transit service that's being provided here. And so I sort of alluded to this, in the next couple of years, East Link Connections project will be coming. This is essentially, provided by King County Metro and Sound Transit. A lot of the things that they'll be doing is consolidating existing transit routes, and the goal is to really provide better speed, reliability, service frequencies, and span of service for bus provided in Issaquah. So it's really about consolidating a bunch of routes and then making the new routes more efficient. So really hoping to make sure that transit in the near term will be a little bit better than it is today. And so, as we look out 20 years, the next sort of major thing that we see is light rail coming to Issaquah. So around 2044, approximately, the South Kirkland-Issaquah Link Light Rail project will be coming. And a lot of this study is really focusing on, what are some things that the city can do now to prepare ourselves for the 20-year horizon. And so just to sort of ground us in why we're doing this transit study, in March 2021, Council had adopted the Mobility Master Plan, and one of the goals that was provided in that was the Policy 6.1, which specifically calls out for the development of a transit study. Next slide, please. Yeah. And very briefly, this is the approximate timeline for the transit study. So it's about a 2-year long project. We kicked off in fall of last year. And some of the major deliverables that will be developed through this are a look at the existing conditions, so how transit is provided today, and then a lot of little deliverables that sort of feed into a future analysis of how transit will be in the near term and then also in the future. So some of this involves, travel demand modeling that we can assume will occur in the next 20 years. And then some of it is also, traffic operations related. So a lot of little details. And then also we're looking sort of at a big picture of what we can expect in terms of growth in the next 20 years, both in the region and in Issaquah specifically. And so some of these projects that we'll be developing are capital improvement projects, which we hope can improve in the near term access to existing transit. And then we're also hoping towards the end of this in phase 2, which I unfortunately did not include on this slide, but you can think of it as the 4th item in the phase 2. So that will be an equity analysis that we're hoping to include this board and commission and get your feedback on. And so this is more of a proposal, just trying to make sure that this board and commission feels like that you can put your stamp on this. We want to have this an open door, so feel free to provide feedback with the transit equity analysis. I think it'd be really great to have this board and commission provide feedback that would sort of make sure that equity is at the heart of what we're doing with this transit study. So that's sort of the second option. I'm hoping to come back to this board and commission either as a full committee or as a subcommittee to provide feedback so that we can make sure that we're developing goals and policies that are aligned with our equity goals. The other alternatives could be just informal updates that I could provide, or if no action or no input is desired, I can just provide an update at the end. But I think it'd be great to have the board and commission provide feedback on the equity component. I think it would really add a lot of value to this transit study. And that is most of my presentation. However, I did want to say, so next slide, please. I did want to say that there's going to be some upcoming ways to provide feedback for the general community. So next week will be a community open house at Tibbetts Creek Manor. Hoping to get some good turnout here. It's going to be like a 2-hour open house. So the first hour will be mostly presenting on the existing conditions of how transit is currently provided today. And then there'll be about an hour to answer questions and just like get a lot of feedback from whoever can attend. And for those that can attend, we're going to record a recording on Friday, and we will post that to the Transit Study website. So that can be shared with anybody, and my email and contact information is on the website, so anybody that watches that can contact me directly and provide feedback. We're also, sorry, go back please, thank you. There's also going to be, and this is all on the website, there's an interactive web tool that we've developed that will be available for about a month. And this allows users to pinpoint specifically on a map transit issues or any sort of transit access improvements that somebody might consider might be helpful. We'd really appreciate that feedback. Then lastly, I will say there's a transit study survey, which we have developed using Google, so you can actually translate it into multiple languages, and we're really hoping to get a lot of feedback. I think we have like 100 responses already, and we're hoping to get a lot more. So all this feedback is really important to us. We really appreciate it, and that concludes my presentation. Thanks.
Thank you for that presentation. I just have a couple comments. I am a huge advocate for public transportation. There's nothing more than parking my car at that transit center, and that 554 bus takes me right to my office in downtown, and I do that at least 2, sometimes 3 times a week. And just the other comment about, I'm really excited about the equity component of this because I want to learn more about the affordable housing that I hear is going to be happening, and I think that's positioned perfectly right next to that transit center where folks can get to that transit center and get to where they need to go. So all this, the talk that you had about broadening the span, the connections from that transit center to more east side locations, I'm curious on how that's going to develop. Any just high level thoughts about the routes that exist there now? When you say east side connections, where exactly are those going on the east side?
Yeah, it's a great question. So East Side Connections is the name of a project that has been developed through King County Metro and Sound Transit. And so we can think of it as being the buses that are feeding into light rail coming east. So it's really like facilitating as light rail comes all the local routes that we have around here, or as well as, you know, the 554, which is my favorite bus, the one that I take because I live in Seattle and I come out here. So as light rail comes east, as it's linking through Bellevue, all these buses will be facilitating and feeding into that, so that you know, folks out here in Issaquah or even further east can all link up in Bellevue now, and then eventually 20 years from now, Issaquah.
Thank you.
So one of the things that we became aware of with the Human Services Commission this last year was that some of the services that would be for people who are marginalized in Issaquah aren't really available to them because of the transit east-west axis. We don't have a north-south axis at all, and it's really limiting for people unless they have a car, and people that are in an economically marginalized position often don't. So transit's really critical for them. Are there any moves to connect us with, say, Renton or Redmond or Woodinville? Right now, we have to go into Seattle and go back out.
Yeah, again, a great question. That, you know, this is something that came up. I actually had I didn't have lunch at the senior center, but I went there and presented today. This is something that I think is on the top of everybody's mind, is the limited amount of transit services that are provided. There's a whole lot of desire for this, and unfortunately, the city doesn't currently provide the transit service, so we can only advocate for the service that we want. But as part of this study, we're going to be looking at everything from like building sidewalks to like add like the connections to existing service, but we also want to look at programs that we could potentially develop that could facilitate, even if it's not the traditional like bus service. Maybe there's other options, if on-demand services with like a maybe not like a bus, but like a shuttle or something, or like potentially other sort of outside the box kind of things that if we don't have the density like you might need to provide another bus route, maybe there's other options that could serve the same purpose, but just sort of get around it differently.
So it is on the radar, though.
We are looking at all options. We really want to make sure that this study is all encompassing. We're not throwing out any ideas that I should rephrase that. We are taking in all the information. We want to make sure that if King County Metro or Sound Transit can't provide it, that we're thinking critically about what the city can do to fill that need.
Thank you.
So my question is a little bit of a dream, I guess, and also I don't believe in dumb questions, so bear with me. I have a hard time understanding why it is that we charge people to get on the bus when the buses are running empty, right? So we're already paying for these buses to kind of tour around town. At least when I see them, you see maybe 2 people and you see this giant, accordion bus with like 4 people in there. And I know that if I tried to get on that bus without fare, I'm not going to be just let on, right? And so I'm trying to understand, how do the buses run with no one in there, but then we're so adamant about like everyone having to pay? They're already running. Why not just let people use them, right? Because I can tell you that if I do the math and I try to do high density driving with other people in my vehicle, and it's a lot cheaper for me to do high density driving than to get on a bus, right, with my family, because you have to pay to get out and you have to pay to come back in. So in my dream world, what we're already paying in our taxes and these buses that are already running would actually be being used. Thank you.
Yeah, it's a great comment. I take the 554 and it is not full, I'll tell you that. And so, yeah, I mean, this is obviously like a bigger issue than what Issaquah can tackle. It's something that, many metro areas have done free transit. I will say that students can ride free now. That's something that is new for this year, so that's pretty awesome. We're all very excited about that. But yeah, I mean, I don't have a great answer for why Metro and Sound Transit don't do it. I do know that a lot of their funding comes from other sources, and fare boxes is part of that. It certainly doesn't cover everything, and I think everybody would say that transit does not have a good cost recovery, and it has to pay for itself from other sources of funds. But yeah, I mean, fare box pays into some of that. I certainly think that if transit were more affordable, more people would probably ride it.
I can't tell you the number of times I've seen the driver allow somebody on without having to pay, just because they're being courteous. That happens so often. And I think he or she, whoever's driving, realizes that they want to have it accessible to everybody, so they have that leniency in their minds to allow that person, even if you don't have your Orca card ready, they'll just say, come on in. So they're very, very courteous. So I too am shocked, but great comments, Lucretia, because it's never, ever really full. You think 50% maybe at most.
I'm usually the only one on there, at least when I go into town, and they are off hours, so I'm always just shocked, right? Like, here's this giant, I call it my private limo, right? Because I'm the only person in there with these huge windows, so.
I think Manny was trying to make a comment.
And Thomas, thanks for the presentation. My concern is, you mentioned the light rail coming in. What's the route of that rail, and which neighborhoods will it affect? Because that in itself is usually people that are marginalized that it really affects. So what direction is that going?
Yeah, it's a great question. We don't have the route yet. It's a thought right now. However, we do know that the general plan tells us that most of the growth will happen in Central. So that is where we plan to have it. We'll be in the Central Issaquah neighborhood. So generally, as for the ST3 funding that Sound Transit has, the general idea is that light rail will be coming along the 90 corridor, and we expect it to be in the central area.
Just follow up on that. At what point will that route be determined?
That route will be determined in the future when Sound Transit is ready to talk to us. But so the point is really to, and this is actually one of the deliverables of this study, is to, Issaquah wants to make sure that our community values are part of this conversation, so we're really ahead of the game so that we can sort of make it easy for Sound Transit to do the right thing by us.
And may I suggest that you contact the Equity Board to work on that so that that lens is in effect?
Yep, absolutely.
Pretty?
I'm a 554 fan too, but I had just a question. I appreciated reading the memo ahead of time, and so I just had a couple of questions around it. And so in the memo, there's terms like higher dependence on transit services, so folks like that, as well as transit dependent and underserved communities. And so my question is, how do you define those groups? Is there like a standard definition, or how do you know who those individuals are? How do you find them? And then casting ahead to like when your actual community engagement starts to happen, how will you know you've reached them and heard from them directly?
I'll do my best to answer this. So transit dependent is it's really just like a educational term, I guess. It's, you know it kind of when you see it, but in general, transit dependence is really like if you don't have options beyond taking transit. And so for me, I am not transit dependent. I'm a transit choice rider. I have the choice to drive here, or I can take the bus. Those are my two choices. If I didn't have choices, I would be transit dependent. Could you feed me the next question? I'll try my best to answer.
Yeah, the other part of my question, well, I appreciate that, because I was like, what do you mean? Because lots of folks have options versus dependent, so that makes a lot of sense. And then underserved communities was mentioned, and I think it maybe ties to Maury's comment around like folks who don't have that access. But how do you, I guess, are there demographic characteristics of those groups, and how will you know that in your engagement process you're doing the right kind of outreach to reach those communities so they actually use their voice in this process?
Yep. Yeah, so to answer this part, we did develop a community engagement plan for this. We actually reached out to Monica, who provided me a whole big list of all all the organizations that the city supports in many ways, or that we sort of support each other. I want to say that my list was like 85 groups or something. I've reached out to most of them, and actually, I was just writing a memo the other day, a couple hours ago, so it's fresh in my mind. I've like interviewed or talked to 26 of the like 75 groups that I have reached out to. So a lot of communications have been happening back and forth. These groups involve, human services groups. It's also the business community. Also talking to Sound Transit, WashDOT, most parties who would, most organized groups that would be somewhat involved in this in one way, shape, or form. I've tried to reach out to. Some groups don't want to talk to me yet because it's sort of not tangible, but we're at least starting these conversations now, and this is really going to be, even beyond this like 2-year study, this is going to be like a relationship building thing that will happen for a while. So it's really about like trying to plant the seeds so that people feel like you can chat with the city about these kinds of things. The door's always open, but sometimes people don't feel comfortable doing it. So we're trying to make sure that if people do feel comfortable, there's ways for them to provide feedback.
Commissioners and board members, just wanted to let you know we are really over time on this agenda topic, although it's a great conversation. But before we move forward, with your permission, Trish, Pat online, I think you have a question. You have your hand up.
Okay, great. Thanks for pointing that out. Sorry, Pat, didn't realize that. Go ahead and speak up.
Sure. Thanks, Thomas, for this presentation. I would like to make sure that I understand. So for this plan you're having, is it just to connect the east side or Issaquah to the west side of the cities? Or do you also consider connecting Issaquah? So if a kid that lives in the Highland has a program in Clark Elementary, maybe it's extreme, they could take that bus, right? And Lucrecia, really nice to hear from you. But I would say my dream is I would like to see what I see in other countries where a kid can get in that bus and get everywhere in that city, go to the skating park from somewhere in the Highland and not be dependent. And the other question is, do you put kids in the dependent category as well in your definition? Thank you.
Wow, that's a great question. Yeah, so I guess the first part, the goal is really to connect the community with local routes, but it's also about connecting the community with where people are going. So for instance, Seattle is the largest employer for most Issaquah residents. So a lot of those bus connections will be going towards Seattle through Bellevue. And it's really, we're looking at where people are going currently. We want to provide transit service that facilitates where we're currently going, because that makes the most sense. That's where we're going to get a lot of good usage. I think it'd be great to have more kids on the bus, that free transit ridership, like as Commissioner Manahan had said, we do want to see more kids on the bus. And I think, that free bus transit, should certainly help with that. Transit dependence, I've not seen it used for kids. Most of the times when we're talking about, transit ridership dependence or, having options, it's mostly about, commuters is typically where it's used. But I could see, in our definition today, I could see that kids being transit dependent, they obviously are reliant on other people to get them places for the most part. Having choices for kids is just as important as anybody else. And I feel like transit can really provide a lot of that mobility that kids really desire and that's required for them to thrive in this community.
What would you like us to do now, Monica?
I think if it sounds like if there are no more questions, and Thomas, if you got what you needed for tonight, then I think we can move on to the next agenda item.
Okay, great. This has been, I know we could continue on and on. And you all know how to reach him. Thank you. Yeah.
Thanks, Thomas, for being here.
Okay, the next item, it will be the Human Services Strategic Plan Overview and Update presented by Hannah.
Well, good evening, everyone. It's so good to see our Human Service Commissioners, our Equity Board members. I believe this is our first joint meeting. Yeah, all right. Well, this is exciting for me to be here. Hi, everyone. I am Hannah Roberts, our Issaquah Human Services Coordinator. And this evening, I'm going to be presenting here on our Human Services Strategic Plan. So really what we're going to be doing this evening is just a really brief, high-level overview of the background, review the strategic plan for those maybe not as familiar with it, as well as give an update of where we're at with our Human Service Strategic Plan. So, what is the purpose? Go ahead, next slide. So really, the question is, what is the purpose of our strategic plan? So for us, the Human Service Strategic Plan, it's the first of its kind here in the city of Issaquah, and it's a 5-year plan where we have that is guided for us to inform some of our funding decisions, as well as our priority areas for our initiatives, as well to kind of guide some of our decision making. We really created it to be a roadmap to help us know where we're trying to go here in the next 5 years. So how was it developed? How did we come up with a 5-year plan? So I think it's really important to note here that we took this overall umbrella equity lens in approaching our strategic plan in developing it. And what that meant for us was really engaging in our community, right? We wanted to know what were the needs from our community members. We needed to know from our service providers, our community members. It was important for us to learn from non-English speakers, as well as those who are experiencing homelessness, youth, seniors. So we really took a broad stance of trying to understand what are the needs of our community and not just assume. So from our engagement with our surveys, our focus groups, our individual interviews, our outreach, we really were able to understand and see what our community needs were. And yes, there was a lot. But in that, we really saw some patterns. And so what we decided to do was kind of pull out and put some focus areas. And I'll talk more about that here shortly. But the focus areas were there to then help us determine what our goals were to be able to address these needs and then create strategic actions. And so talking a little bit more about the equity lens and really in the approach of creating our strategic plan is Human Services, really, we serve about under 8% of those who are living in poverty. And it's really worth noting here that over 3/4 of those living in poverty are non-white. So we really want to call that out and understand that this is an inequity that we need to address in a lot of our services. So focusing here on what our priority areas were. So what we identified in summary is this overarching community need. So this is really something that we saw and in all of these categories was there was a lack of space, limited resources, limited services in Issaquah. And so really we want to use our existing services as well as new services in our strategic plan to be able to address those needs. Also is physical and behavioral health. So just like many of those here in our region, Issaquah is no stranger to our behavioral health crisis we're experiencing. Lack of providers, high need, especially after COVID. So we really saw that as extreme need in all categories, youth, seniors, ethnicities. So that was something that was very important for us to address, as well as the physical medical cost was high. So providing support in that. The other thing was housing continuum. So that's really twofold here. So that's serving those who are experiencing homelessness in Issaquah, but also homelessness prevention. So making sure that we are supporting the supportive housing programs and financial assistance. So those are two lofty categories within that. The other thing that was important that we heard and learned was just a lack of language access and cultural services here in Issaquah. Issaquah's diversity is growing. We have 30% of our residents who are English is their second language. And so we need to make sure that we are meeting those needs and having services that address that and provide accessibility. And then we have community resources, which is really this bigger bubble of all the other needs, basic needs, food necessities, financial services. So that's kind of a larger category there. So where are we at right now? So like I said, this is a 5-year plan, and we are still kind of in the beginning stages. So the resolution of the strategic plan was adopted in March of 2022 by our city council. We have had about a year of implementation, and we've learned a lot. So today here we are in 2023, we are implementing, continuing with our work plan. And then we do have a revision, sorry, it's really small, but there's a revision scheduled at the end of this year to just we understand that this is, the community needs change. And so we may need to re-advise, look at our strategic plan. We also have another revision scheduled in 2024, right before our next funding cycle to help address that. One of the things I want to address is, right, what have we been doing for this last year, right? Where are we at? And I think there's some lessons learned, and there's some great highlights that I'll be addressing and some challenges also that I will be addressing. But right here, I want to provide a few graphs for a visual. So in the strategic plan, just to kind of lay it out, so I have our focus areas. Within the focus areas, we have the identified needs and then goals to address those needs. Under those goals, we have strategic actions, right? So those are things that we can achieve, measurable actions. There's about 33 of them. And in 2022, we accomplished about 85% of those goals. And so looking at it more in the categories, some of the bigger ones that we are kind of in the delayed category are some of these lofty ones, which are a resource center as well as transitional housing for homelessness, and then a few educational events that we weren't quite able to get to in 2022, but we hope to prioritize it here in this next year. So I just want to do a few shout outs for some highlights here. So one of our biggest accomplishments, I would say, that I am so proud and want to give a huge shout out to the Human Service Commission is our 2022 Human Services Grants. That is one of the hardest things I feel like a commission has to do, stepping in, where basically our mayor and our council allocate a certain funding amount for human services. And their job is basically to look at all these wonderful organizations doing incredible work, and they have to decide which ones to fund and how much. Not an easy task, as I'm sure you all remember and attest to, because we want to be able to provide support everywhere. But the unique and special thing about this process and this funding cycle is that we had our strategic plan. So we had our roadmap to be able to help us with making those really tough decisions. And the commission did an incredible job staying true to that to help guide where funding should go. So huge success there. I would say that followed our strategic plan. Another thing, I won't go too much into detail because you'll learn more about, is our culture conversations. This is really an educational event that we want to provide for our community that offers an opportunity to be inclusive and invite those and celebrate and honor. This last year we did Black History Month, Juneteenth, Pride Month, and Hispanic Heritage Month, and we'll be having more on that presentation. The other thing that I want to highlight here is we had resource fairs. So that was exciting. We did it in person, which is kind of new for 2022. And we had 2 resource fairs where we had I think about 40 providers for each one come into our community center and just be able to provide information. So that was very exciting to be able to participate in. And then we have our homeless outreach program, which I'm not going to steal their thunder, but it is an incredible program, and they've done amazing work there. Some of our challenges, though, right, it's and lessons learned. This year, to be honest, staffing, and not any stranger to many other organizations, but for 2022, we were not fully staffed. Kaylin, who's our second behavioral health coordinator, came in mid-year, and right as she was coming on, I was taking a maternity leave. So thank you so much to my team for holding down the fort while I was gone. But that's the truth of it. This lack of staffing, I think it attests to maybe about that 15% of not being able to get to quite those strategic actions, and then ultimately limited resources. I mean, we're still struggling with that. So what we're doing here and where we are next steps is we are working through our work plan in 2023 to continue with our strategic actions, and then looking at a revision at the end of the year, and then just to put a magnifying glass on it a little bit more. Here in Q1 and Q2, you can see here some of the areas that we do want to focus on, and those are the areas ultimately that we were a little bit delayed on in 2022. So really focusing on aging in place resources, emergency housing program, and supportive housing providers as well. So, and then the behavioral health resources. So again, I'm here just to talk about our strategic plan. We are going to be having more presentation on our behavioral health and homeless outreach program, as well as our community court and cultural events that we're having. So please leave your questions for those folks, but just want to open up the floor to see if there's any questions about human services or our strategic plan or any of that fun stuff. Yeah, okay. Oh, okay.
Just really quick, I wanted a clarification about the resource fairs. I attended one that was called something like Newcomers. Is that one of the resource fairs, or is that in addition to?
So we, for our resource fair, a little more details about that is we partnered with our Artie City events. So we had Welcome Week. We invited our providers. So if you were there for Welcome Week, you saw all of those tables and booths there. And then we had a Chalk Art event. So we partnered. That was the hottest day of the year. But then we partnered with our Arts Commission and our arts team to be able to participate with that. So we found that to be the most successful, is people who are already there can kind of wander and meet some new resources. Yeah.
Thank you.
Yeah. Yes.
The cultural conversations that you have, is that in person or is it done online?
So in 2022, that's been both. And so we were excited this year. And again, I'm not going to steal Marisol's thunder, but we did have some incredible events that we were excited to do in person, especially for Juneteenth, Hispanic Heritage Month. But I know for Black History Month, when it was earlier in the year, we did like a trivia night and then an educational conversation as well. And those were virtual. So okay. I know we're headed to in person though here.
If you ever need some great ideas for cultural conversations, we have our friends from the Baha'i here.
Yes.
And I've attended one of their events. They did a fantastic job, so keep them in mind.
Shout out to them. Thank you so much. Hi, Manny.
Hi, Manny Brown here from Commission. And you guys did a terrific job on this strategic board. I mean, planning. It was amazing. What I do like about it is the fact that you have constant built-in revisions and taking a look of where you're going, what you're doing, and I really do appreciate you doing that.
Yeah, definitely. Well, I'm sure we'll be talking to you more about those revisions, so. Thank you, Manny.
Commissioner, board members, I think Shay has a question online.
Oh. Hi, Shay.
Hi, yes, I was just going to ask, are there any plans to add additional staffing?
To Human Services, I will let Monica answer that one. Thank you.
Oh, thank you, Hannah. Thank you, Shay. At this point, there are and there aren't. At this point in time, we will be considering requesting additional staffing for the behavioral health and homeless outreach program. So we hope for additional conversation on that as those needs grow in the community. But I think that's the plan for now. Thank you.
You all are wonderful. Thanks for being here this evening, and thanks, folks, for joining us online and public attendance. Really appreciate you all here. This is important work. So, again, nice to have everybody here. This is bringing it all together, bridge that gap. So, Perfect. All right. Well, Trish, back to you.
All right, well, thanks, Hannah, and welcome. Yes, welcome back. Okay, so next up, we're ready on our next agenda item, Monica? Okay. Next up are Amir and Kailan. They're going to talk about the Behavioral Health and Homeless Outreach Program.
And team, start talking and give me 20 seconds to switch the slides. So do entertainment.
Hello. Thank you for having us. I'm Kaylin, and this is Amir, and we're both behavioral health coordinators for the city of Issaquah.
Yeah, so if our slides are up, I'll get started. We started the behavioral health program when I joined the city of Issaquah, May 2021. And it was a collaboration between the Issaquah Police Department and our Human Services team. Sorry about the mic. So the goals of the behavioral health program are to divert people from the criminal justice system and try and help them and connect them with resources that not only will hopefully help them assist them in overcoming their challenges, but lower the probability of the same challenges arising in the future and reduce the number of 911 calls that come in as a result. To date, we have received 223 unduplicated referrals, the majority of which are from the police department, but we also accept referrals from other sources, including the courts, other city departments and the municipal court. And for a time there, we also accepted referrals for the community, but we had to discontinue that because of our capacity to meaningfully follow up on any referrals we receive. Yeah, and let me add that within the first 3 months of the behavioral health program, about 1/4 of our referrals were for people in the community who were unhoused. And so based on that, we felt like we needed to bring a homeless outreach program in-house as well. And to talk about kind of the history behind that and where we are now is Kaylin.
Thank you. So I'm going to bring us back to a time pre-pandemic, which is 2019, and that is when the city of Issaquah was primarily providing services as far as homeless outreach through their human services grants, and that was to regional nonprofits such as Congregations for Homeless Men or the Sophia Way, or also Reclaim, formerly known as the Snoqualmie Valley Shelter. So that was in 2019, and in 2020, as the world changed, the City Council approved a pilot program with our local food bank, which then brought the homeless outreach coordinator position to Issaquah. So that made for a homeless outreach coordinator to be outreaching to Issaquah to kind of find out more about what people experiencing homelessness were dealing with here in Issaquah, what that looked like, and provide more data around it. In 2021, when the behavioral health program was launched, as Amir mentioned, there was seen to be like an intersection between these two programs. And so they decided that they would bring the homeless outreach coordinator position in-house. And then in 2022, they did approve to increase the staff of behavioral health coordinators to address this larger program, which encompasses both homeless outreach and behavioral health. And that is when I was lucky enough to join the team. And all of this can be seen and tracked through the publicly available dashboard, which is the homeless outreach dashboard that's available on our website. I believe that it began in 2021, and it continues throughout our progress. So we update that monthly with metrics on how we connect residents to services. And to talk more about those services is Amir.
Yes, so some of our support services by category that we've been successful in getting people connected with is obviously behavioral health, mental health, substance use treatment, homelessness related services, things like shelters, even permanent housing in some cases, getting them connected with their IDs, medical insurance, youth and family issues, healthcare, community needs, large need for social support post-COVID, and other resources as they come to us. Everybody kind of comes with their own backgrounds, so we're not really obviously sure what anybody's going to present to us, so we need to be ready and able to address all kinds of things. And this we pulled actually in January, so this is not up to date. I think our numbers, actually, we just broke 1,000 total service connections through March. And so we've been most successful at getting our unhoused community members connected with temporary shelter, but we've also been successful getting them connected with a number of other things. And that temporary shelter number is inflated probably by our Motel 6 cold weather sheltering. And a lot of these resources are not available in Issaquah. And to talk a little bit about what is available and what's not available in Issaquah, I'm going to throw it back.
Thank you. So as we were kind of discussing earlier with Thomas, this is probably a familiar map to you folks if you use Google Maps, and this is a poorly drawn, not accurate city representation of where Issaquah is. And as you can see from little icons that I've created, so some of these icons, if you can see a bed, that's where a shelter space is. The stamps are Department of Social and Health Services, so DSHS, where people can apply and receive state benefits. The little ID card is where you can go to apply for a license. And then the little head is meant to represent more mental health or substance use treatment services. So as you can see, all of those exist currently outside of Issaquah. What we do have here in Issaquah is we have a very robust hospital system, we have a very robust jail, and we have a very robust food bank. So those are services that we don't necessarily want to keep encouraging our residents to use besides the food bank, and it has been barriers. There's been a lot of barriers in connecting residents to these other services, especially when they are dependent on public transit or they don't have the economic ability to afford a private transport car. So a lot of the time we will be trying to help people with these services, and that's like a huge barrier for us. And if you don't mind going to the next slide, please, Monica. So a lot of these barriers that we're talking about do revolve around transportation. As we just saw, a majority of the services we're trying to connect folks to do exist outside of Issaquah. So that can be a challenge to make sure that they have a good ride there, waiting for the appointment, right, for however long that might be, and then having a safe ride back to their home. We also have a barrier with technology. For a lot of our folks who are lower income or living outside, it's pretty difficult to have consistent cell service or even have a consistent place to charge your phone so that you're able to access a lot of these services. Due to the pandemic, a lot of service providers moved to more of like a telehealth or a phone model where you have to call in to make these appointments to even be able to get there. And so that can be a large barrier for folks. And especially for our elderly or youth, the technology literacy can be a big part of this. So if we are working with someone who's not familiar with going online, making an appointment online, keeping up with their MyChart online so that they can have access to their medical documents, this can be a big barrier. And as Hannah touched on, and also Thomas, another big barrier is just time. When we meet folks, they're typically at a low point of behavioral crisis, and if the appointment for them to kind of reach a mental health counselor or reach an inpatient bed is months away, we're not sure what might happen in those months, and so we try to provide that adequate support throughout it. Can be a challenge, and we also are limited in staff with just the two of us kind of handling the entire city, and also just having funding limitations for our service providers. So as we've heard, you know, a lot of service providers are at capacity and are not able to handle this high demand of need. And with that, we want to open it up to questions and discussion. Hi, Tony.
Hello. My question is in relation to one curiosity question. You mentioned, of course, the outreach. Is there a mix of reactive outreach, where referrals that you talked about, versus proactive, let's say getting out there, pounding the streets, going out to the homeless camps? What is the mix there?
I got it. Okay. Yeah, that's a really good question. So, like I said, 25% of our referrals initially in that early period were for unhoused community members. And I think it was Monica that said, you know, why are we waiting? Let's be proactive. Everybody unhoused is in crisis. Right. So we don't need for someone to tell us that these people living, you know, outdoors are in crisis. So we do attempt to proactively do outreach, but we also accept referrals via C-Click-Fix, via an email, where community members can point us in the right direction, because, you know, Issaquah, geographically, big space, and you know, this community tends to move around, and so we want to be able to meet them where they are when we can.
And with that, I would like to jump in to add a few things. First of all, I'm just so humbled every single day when I work with Amir and Kaylin. The work that they do, it's really, really difficult. And I want to give you an example of what they experience on a daily basis when they do proactive, because that's our intent, ideally. By now, we've met probably every single person that's homeless in Issaquah. Multiple times. I don't think that if we get a referral for a homeless person right now, that it's a news for us. The challenge that they experience is, and I'm going to give you 2 examples. One, let's say they go and meet with someone who is willing and open to accept services. The next step is, oh, let's find you a place to be tonight. So they contact the shelters in the area. I can tell you that 99% of the time, the shelters have no space. So then they are, then we all get together, get on a phone call. What's the next step? What can we do? In the case that they're lucky and then find the shelter space, then the next thing is, okay, we need to provide transportation, or we have bus tickets. If it's during the day and we are lucky that the bus goes all the way there, then that might work. So that's a best case scenario. But as I said, 99% of the time, there's no space, there's no shelter. Now added, the person might not have an ID. There was a rain last night. Even if they had an ID yesterday, now it's all wet, it's gone, they lost it, they moved from one place to the other. So then many places are not going to accept them because they don't have an ID. So now they need to go find a way to go to get an ID. It's a temporary ID. It's going to take for a few more weeks. And then the cycle just continues that way. So again, and this is actually a best case scenario. And it takes often a few weeks for someone who's willing to take services until we are able to find something temporary for them. And it's going to take years until they get into permanent housing, because the wait list often is 3 to 5 years if you go mainstream. Now, the second example that I want to give you is people who have been homeless for several years. They have been, they learned to no longer trust or believe in any services that you provide. Like often we go, hey, we would like to help you, and they say yes, and then, oh, by the way, we don't really have anything to help you with. So they lose trust, and they do not want to accept services. It's easier sometimes once you've been defeated so many times to just say no. And so then we end up with then we are going to add up complications of often you see them in the city, but they might not be on city property. Issaquah is a magnificent place, but they are often private properties. Probably those are easier because then we can communicate with the business owners or the private owners. But often folks find and build encampments on Washington State property or King County Parks property, which then it's not our jurisdiction. Then we need to start coordinating with those jurisdictions, which again takes more and more weeks. So I'm gonna stop being on my soapbox here. I just wanted to tell you the realities that our staff deal with and folks ultimately who are unhoused deal with on an everyday basis. So then, kind of like, that's what I'm trying to say. We are trying to be proactive, but often you see folks in the community who are homeless and probably you're wondering like, oh, I wonder why they are not going and doing something. We most likely have been doing something for quite a while. We just don't have quite yet a solution, right? So, and with that, I don't want to be just all gloomy about this. I think in the big scheme of things, last year in 2022, a huge success. Folks were able to find permanent housing. We had 27, now we are up to 30 people. So that's huge. That's huge success, especially how difficult it is. So there are pluses and minuses. Thanks.
Follow up to my question. From measuring success, and Monica, you did talk about that, but are you tracking success from an individualized standpoint from, let's say, a certain individual you might encounter, and how do you measure that success? Is it right when they get into housing, or is it to when they not only have housing, but they have, I guess what I would kind of call an adequate life, you know, so that they will never be homeless again, whether it be maybe they need drug rehab, maybe they need alcohol rehab, or mental health assistance, or maybe education or something like that, whatever it might be.
Yeah, we make individualized service plans with everybody that we come in contact with. And so part of that is for them to set their own goals. So for instance, someone's goal might end up being employment, right? And they're thinking employment is the way to get that income to get into that permanent housing. But I think, as we all know, before you get that job, you kind of need the identification documents before that. And so there is somebody that we've been working with who's been trying to get an ID for close to a year. He's never had an ID in the state of Washington, so we've had to kind of gather these documents from various places that they've lived throughout the US, and that's a huge barrier. But I think that they are very close at this point, and I would say that for us, that is a big success. And so we like to celebrate those successes all along the way to what we see as that, you know, permanent housing or stability life. We definitely want to celebrate all the small successes for our folks so that they do understand that, like, we're working with them and alongside them on this journey.
Fantastic. Thank you.
Of course. Yes.
Thank you for what you do. Incredible. I'm really impressed that 2 of you are holding this down for the entire city. With that, I'm going to ask, how is it that you get most of your referrals? Is it through police interaction? Is it through people checking in at the food bank? Or how is it you're getting most of your referrals? And then I have something after that.
Sure. Most of our referrals come directly from Issaquah Police Department, who can email us. And then they include a name number. They don't include any confidential information. And then we go in and we look that person up and we do our background, and we get in contact with that person. Start like that.
Okay. So then my next question is there a possibility, do you see in the future, is there any way it's going to happen that we'll have community response teams rather than armed policemen responding to people in crisis?
Let Monica take that.
Yeah, I'm going to take that because I also was going to say an interesting shift that we have seen in the last, we started tracking data since September of 2021, so a little bit a year and a half ago. An interesting trend that we noticed as more and more people hear about the program, often we have people coming to our door and self-refer themselves. So that's actually a big shift that we've seen compared to the police. And so to answer though your question about community response, we are now piloting a response program with police. At this point, we are just in early stages where the 911 calls still go through dispatch, and our police department chooses to call us on the scene. So it's a transition place. As we hope to have additional staff, then yes, the goal and the ideal would be to, as calls come in, for staff to be dispatched directly. So we are not quite there right now. We are still a referral program. But as I said, often referrals come straight from folks who need the help because they know us. And so, yeah.
Thank you, Monica.
Thank you. And with that, since I have the mic open, I know that online Shay had also a couple of questions.
Yeah, great work, you guys. I'm so happy to see all the work that you're doing to help Issaquah, but I just wanted to ask, are there any specific parameters that you all have that actually disqualify people from utilizing services?
As far as our service in helping them with resources, Shay, sorry, just to qualify.
Yes.
Okay.
So you've got to be referred by one of those entities that I identified. Right now, we're just taking referrals from city departments. So if you've been referred by a city department and that you don't have supports externally, meaning, you know, we're going to prioritize people that have no support over people that do have some support. That's kind of how we decide, you know, who to work with.
And then I think if I may add to that, Shay, and I'm not sure if we all understood your question correctly, but also just know that, so we don't turn people away if they need the help. We might just not have right now the staffing capacity to work with. Like, I was just meeting with staff yesterday, and the two of them work actively with 70 people right now. Those are only people who are active as of the last few weeks. They interacted with staff. We have just as many people who are inactive but need services, but the staff don't have capacity. And I just want to give you a comparison that for this level of work, probably one person should not work with more than 10, 15, max 20 people at the same time, because they just need a lot of work. And yeah, so Shay, did we all answer your question?
Yes, you did. Thank you.
Thank you.
Yeah, this is Manny again. It seems that we had 3 presentations tonight, and all of them seem to boil down to staffing. Is staffing problem due to funding or availability of others in your field?
It's a great question.
I think it's like a microcosm of like all of these factors kind of contributing, to be honest. It's a hard position to attract people to. It's difficult.
Has a high rate of turnover, definitely.
Yeah. And to the second part of your question, Manny, I also want to remind you, as you heard kind of like the timeline on where the program started, in 2019 and still in early 2020 actually, as the pandemic hit, this division was a 1-person show, and I was the only person yet on the program. So I'm still looking back, and I can't believe that everything happened in the last 2.5 years or so. We created a division, so I think we moved from 1 staff to now have 4 and 3/4 staff, which I think it's a huge change for a city of our size. And so that also has many other resources that they need to tend to. But yes, we hope to continue to add a couple of more staff in the future for this work in particular.
So just follow up. So the funding is there for the staffing? Is that what I'm hearing?
And not officially approved by City Council at this time. So we plan on going for the next budget cycle for next year to request, hopefully to obtain approval for additional staffing. So for this year, we don't have plans to add in 2023 new staff, but we hope early 2024 to, again, should we get approval from City Council.
Thanks.
And I just have a quick question, you guys, and you know, I think the work you do is tremendous, and as you know, I volunteer at Issaquah Community Services. How do you handle the influx of refugees and people that are seeking asylum that are saying that Issaquah is their home?
Do you mean?
Are you able to provide them services? Are you able to help them find a place to live?
We definitely try to help everybody that we encounter with whatever service they're looking to obtain. Right now, I would say if an unhoused refugee was here and looking to make Issaquah their home, of course, we would first want to refer them to like a temporary shelter. In the meantime, while we try to locate that affordable housing or long-term needs. Okay. I think Monica had something to add to that.
No, I don't think so, other than, yes, we try to help everyone, but we don't have a specific program that focuses on helping refugees. We would try to connect with regional resources that are specifically for specific types of refugees.
And you guys are aware, and I'm only aware because of the volunteer work I do, of the new state program that's providing rental assistance. Yeah. And that's really new. That just was released in January. Yeah. Okay.
Thank you so much. Oh, I'm sorry.
I think we've got some more. Okay.
Just real quick, I think I heard you say that currently you're working with 70 people actively?
Actively.
Okay, and so then I got a little bit confused because I became aware that we also have somewhere between 90 to 95 unhoused youth. And so where are they in the system? Are they not part of the system that you all run, or are they outside of that?
So we do work with youth who are unhoused. Typically, we try, like we're saying, like, you know, when we meet somebody, we try to individualize their service connection. So if we met an unhoused youth, you know, probably the first places we're going to go to are the garage and Friends of Youth to try to get them connected to more appropriate social services and mental health resources, and then hopefully that would get them on the path to their housing, right? Or even the Landing, the youth shelter in Redmond, which does a terrific job in doing that. I think the difference with the numbers is that we're not specifically serving youth, so within our 70 active, there might be youth people within that, but that doesn't mean that there isn't that larger number of youth that are currently experiencing unstable housing.
And then I think adding to that, Lucrecia, really quick, the numbers that you have are for the Issaquah School District, which is more than just the city of Issaquah. Our program focuses only on the city of Issaquah. And then often the youth are not always unaccompanied. We often work with families who have, so then that's why the numbers might not be. And then last but not least, sorry, I've been talking a lot, commissioners and board members, is we have 70 active people because that's what we can handle. We have probably another 70 that we could engage with. We just don't have the capacity. We just have them on an inactive list right now just because, yeah.
Go ahead.
Thank you. Yeah, thank you for the work you all do. My question is, I know at the top of your presentation, this was described as a diversion program. And so can you share with us what, if the police responded and these folks were referred to you, what their pathway would be?
I would say that it wouldn't always result in an arrest. I think that we do have terrific officers in our city who are aware of these challenges, and they typically try every avenue possible, and we're a resource for them. That's one of the avenues that they can try in these scenarios, high-stress scenarios. So I don't think we have exact data on like diversion numbers, but I would say that if somebody was experiencing a behavioral health crisis, their main focus would be to de-escalate the situation. And they also have the mobile crisis team, which is a countywide program that they could call in to help if we were not working that day or unavailable for another reason.
I just had a question about, you're actively engaged with 70 people right now, and you're at capacity. Do you have an average amount of time that it takes to resolve each case? And no, okay.
I think it's all dependent on the case. You know, some we've been with since May 2021 when we started. Some take one phone call and one resource connection that actually works for that person and is meaningful. So, varies greatly.
Definitely.
This is Jaime from the Human Services Commission. I had a quick question. Out of the 200 referrals you got from law enforcement, do you guys track like demographics?
We do have room in our spreadsheet to track demographics, and we do, as often as we can, identify or request that information.
Thank you. Now, I'd follow up because I work in the criminal system, and what we've seen for Snohomish County specifically is folks have, with legislation coming down and moving pretty fast, is folks not being locked up. So what that means is they're out in the community to, you know, garner support. So this is something that's happening throughout all counties in the Washington state. So I'm really applaud your efforts to keeping kids out or keeping people out of the system due to behavior issues, housing issues, things that I would call status offenses. I think that is the best route. And so now you're seeing a recognition from the Supreme Court judges to legislation to see how do we keep our people in the community to thrive within the services. What it's doing, it's forcing, I don't want to say forcing, but it's having that conversation with local, city, county, state to say, what are the resources that we have through behavioral health, housing, we talk about trauma, we talk about SUD, mental health. I think these are good starting points because you've seen a lot of counties and cities trying to garner and grapple this concern because historically it's always been a criminal. And so for me, when I hear both of you all talking about it, it's just, we can do more, but I think it's a good starting point to kind of start recognizing that historically it's always been a criminal issue. And now it's like, okay, how do we now keep our folks in the community to thrive within our community. So I thank you so much for addressing these efforts.
It's a great comment. Thank you so much. Yeah. And thank you all for the work that you do, because it's really important to our work as well. So we appreciate it. Thank you.
Okay, great.
Thanks.
Commissioners, board members, quick time check-in. Thank you so much, team. We do have the agenda. As the Human Services Commission starts at 6:30, and we usually, for the Equity Board, we have a 2-hour agenda. We do have the agenda until 8:30. Just doing a quick check-in. We do have one more presentation. Are you all feeling ready and okay to continue? I know it's a lot of presentations for you tonight. Hopefully you find it helpful. Okay.
Okay, great.
Okay. Marisol then.
Okay, Marisol, Community Court and Cultural Events.
Buenas noches a todos. Mi nombre es Marisol Fischer y soy la manejadora de casos de la Corte Comunitaria de Issaquah. Good evening, everyone. My name is Marisol Fischer, and I'm the Community Court Case Manager. If we have our presentation ready.
Sorry, I was sharing on my end, but I see it's not sharing. Sorry.
So what is community court? So community court is a non-traditional approach that provides practical, targeted solutions rather than traditional punishment in cases involving low-level offenses. Community court uses a problem-solving approach to address the participants' underlying reasons for committing those crimes, and that to combat the revolving door that we get sometimes on the criminal justice system. We get to know the whole person, basically. When somebody is referred to the community court, they will join, observing our reviews, and they will just have questions. We get to know them because they will be coming as a person. We will call them by their first name. Excuse me. If anybody has been to a court hearing, usually it's by your last name. So this is a more wholesome approach. Also, when they enter, the first thing we do is a risk assessment, and that is done by the case manager, which is me. And I will get to know them. I will create that bond, that trust with them, where I will get to know more of their needs. I always start with, this is a time for us to get to know each other and to learn about the needs that you have so I can connect you to the right services. When they decide to join, they will sign a contract with the city, and they will agree to fulfill a list of things. Usually that will average on 6 to 9 months per case, and that's also depending on the person. They will look at their cases and all that. And when they are done, their cases will be dismissed and they will be closed. Some of the recommendations with the community court are community service hours, and we usually try to find them local resources, and I try always to talk to them about the things that they like so that they can see other opportunities of engagement. They also need to do either mental health sessions or SUD assessments and treatment, and weekly check-ins with me, among other things. If we can, yeah, thank you. So on these slides, you can see some of our numbers. The community court opened in August 2021, and since that, we have had 15 participants. Just as our behavioral health and homeless outreach, we also have a dashboard, and I hope you get to visit on the website. If we can go to next, thank you. The Virtual Resource Center. The Resource Center is a free, low-barrier access point for people to meet with providers. The VCR is offered weekly, just as our hearings, and it's actually provided before the hearing. So if anybody is needing to meet with, I don't know, I can mention a few of the resources that we have. DSHS, HopeLink will join. We have Sound Integrated Health. We have Ideal Options, and also our local food bank, and they will get to meet with them in a virtual resource room. And when I say low barrier, is because we try for them to find a space where they can do it. I mean, they can do it on their phone if needed, because it's virtually. Or here, this is also the courtroom, so when they come, they have access to 2 computers as well. Thank you. So some of our successes, we have had 9 graduations and almost, I'm very proud of this, 200 hours of community services. This is people that has been in our system for a long time, and this is one of the basic things that they ask, to do community service hours. And when they hear that they have to do that, sometimes they're a little reluctant, but when they get to hear, the other options that they will have, because this is people that will have to look for all those resources themselves, and having me as a resource for them, it's, like they get to learn about more things. So I'm very proud of the 200 hours that they have done. 270 resource room connections made. So the resource room is actually open to every resident in our city, and also to the city of Renton, because we share that resource room. It's a virtual resource room, and it's really good for our providers as well, because they get to join online, they don't have to travel anywhere, and they can just meet with people there. And some of our challenges, of course, we have had some. One of them is the referral pipeline, and this is just as I was mentioning, when people get in to observe, sometimes get a little longer time for them just to be observing because of various reasons. And they get a little tired of that, and at some point we lose them, and that's a barrier. The wait time to obtain mental health, as you have heard from my coworkers, getting them to meet with a provider is a little hard. Although we get them appointments, sometimes transportation is an issue, or if there's not enough counselors, they cannot meet with them, so that's another challenge that we have counted. The lack of services to transition participants out of homelessness. So these are people who are not only based in Issaquah. Some of our participants come from Tacoma, Preston, Fall City. Because they commit a crime in Issaquah, the court that they have to go is this one. But if we try to access a service in one of those cities and it's not available, they cannot connect. And then finally is reduction in qualifying criminal filings. So things have been changing after the pandemic. A lot of the filings, the criminal filings, are changing, and many of them are not, they don't qualify to be in our court. So unfortunately, they cannot join. And that's just that was just a picture of the graduation invitation. And I will just say that for the next one, I will share it, and I hope that any of you can join us. All of them are virtually, and they are very, very nice to be. Thank you for the next one. Then these are our community cultural events, and actually, as Hannah mentioned, this began as a response of the increasing desire for cultural conversations in our community. These are some pictures of the events that we have facilitated. Like Hannah said, we had the Black History Month, Asian Pacific Heritage Month, Pride Month, Juneteenth. The next slide, please. Hispanic Heritage Month, and the Welcoming Week. This is something that we have done in-house with the help of many people in this room, so thank you very much. And we recognize that it will be better led by local cultural organization, and for the coming years, we are actually already reaching out to a few organizations. We will reach to more in the hope to partner with them and to continue this legacy for cultural events. Muchas gracias. Thank you very much. And if you have any questions. Yes.
Hi, Marisol. Thank you for your presentation. I got a question about, I just want to make sure I understand the process. Does the process work this way, in which, let's say someone gets, let's say arrested for a minor offense, shoplifting or something like that, then the public defender can decide to refer them to your organization, and then they go through the process. Is that correct?
Thank you. Thank you, Tony. Yes, and so usually they will look at the calendar. We will have like arraignment or pre-trials, and they will look at the calendar for all of them and see who are with low offenses. And the defendant and the prosecutor will advise, like, if they could offer him anything.
Oh, the prosecutor as well?
Yes.
Oh, that's great.
Yeah.
Now, the follow-up question to that, do you have an example of what would be considered as low-level offenses that might be referred to community court?
Shoplifting is one of the examples. Theft, trespassing as well, yeah, kind of thing.
Okay, thank you.
Marisol, I have a question as well. Are you seeing the youth involved in this opportunity? Are you seeing a reduction in repeat? I mean, does this get them out of?
That's a great question, thank you. We have had so far 2 youth that I can think of, and actually yes, because they haven't been back. And actually one of them is still in the program, but you can see the change from, you know, the offense was minimal and involved some bad choices that they made. And because of the resources that has opened doors for them, one of them was able to find a better job and to go to further education, which is what one of the things that we also offer in the resource room, meeting with colleges. And they have found resources that have opened other doors that were not before. Yeah. Yes, please.
I think you answered my question with your last comment. How does that, by going through this service, it gets removed from their record, so it does not disrupt them from getting into school, like these students, et cetera, applying? Does that have any, goes off once they do this? Is that
Yes, correct.
Okay.
So whatever is the offense that you committed, it will get dismissed. So at the end, in the graduation, which is, again, is very touching, when you hear the judge and the prosecutor said, your case is dismissed, is huge. Mm-hmm. Because, yeah, it won't show anymore. Yes, please.
What does it mean to graduate? Like, what are the requirements for graduation?
Of course. I will use the word that Kaylan used. We use individualized approach for them. So anybody who joins, we will look at what their needs are and what is it that they, need to accomplish. For example, if somebody comes and we see that they have been stealing, but they have been, they get an assessment and it's substance use, one of the things in their contract will be substance use treatment, classes for substance abuse, and community service hours. So when they accomplish all of those steps and things, they can get graduation.
I'm sorry, Marisol, another question. When you mentioned, maybe I misunderstood, your dashboard that you showed on screen, you mentioned, I believe since 2021, there's been 15 individuals that have been in the program. Please don't take no offense to this, but it seems kind of low. Is there a reason for that? Because I look at it like Issaquah, probably a lot of minor crimes. So with only 15.
Exactly. I mean, and I should have put that as a challenge, just because we haven't been able to capture many of the people, just because maybe they have like one small crime, but one thing that won't help them enter the community court is domestic violence. And and even if it was something against their family member, whoever, they won't get to enter. And we have a lot of those cases in Issaquah. And even if they don't have like many others, it's one that won't help. Yeah, Monica?
Yeah, no, thank you, Marisol. And I was gonna add, I think the municipal court here in Issaquah, it's also a smaller court, and as they wanted to launch this, they wanted to also start small and to learn lessons at a smaller scale before expanding it. Also, this court being a unique municipal court, they did it on their own with limited, again, resources. Often you're going to see community courts associated with King County courts, having, again, more resources and larger courts, and us just doing it all by ourselves. It was just intentional initially to start small and then increasing it. But as Marisol said, definitely I think there's now, as we are learning the lessons, there's interest in growing more and then working and trying to see if more people can become eligible for community court.
I'm sorry, I don't mean to monopolize, it's a lot of questions. Are you tracking, Marisol, demographic data on the 15 that entered the program? Or what are you seeing right now, if you don't mind me asking?
Yes, we are. And we have, the rainbow is big. So we have seen a lot of different ethnicities. One thing though, unfortunately, some of the cases in our court are, if there is a culturally diverse person, usually their cases are more DV related, domestic violence, and they are not eligible for community court.
Got it. Thank you.
Manny.
All right. Is there, I guess, an opportunity for someone who is charged with domestic violence? Is there something going on in the city for that? For them to go to, or kind of like this?
As community court? Well, not in our court. I would say there has been some conversation about getting our community court more open and looking more at individualized things for the people who are committing the crimes. But it's not offered through the community court. I mean, sometimes will be through the behavioral health, and they will be able to help them. Mm-hmm. And in many cases has been the help that they get.
And I can add a couple of things. And again, I don't want us to go too much into the legal part because we just don't know that part. But there are two small pieces of information that I do know. One, anyone involved in a domestic violence case, they do have an advocate that works one-on-one with them. As Marisol said, sometimes they get referral to our behavioral health program. But also there are other state legislations and requirements that from police to court, everyone has to follow, that it's a more rigid process currently that does not allow for that flexibility. Like I know, for example, back in the day, we were working with the police department, and they were saying there's a state requirement that when they respond to domestic violence on the scene, an arrest has to be made. Somebody needs to be arrested, and then that. So again, it's just there's some more rigid processes that need to be addressed at state level.
I'll just say, Marisol, this is Jaime from Human Services. Thank you so much for the cultural events. I think I attended 3 of them, so thank you so much. I will continue to attend, so I just want to say thank you for doing all that great work.
And I'm going to jump in to say that, Jaime, thank you so much for bringing that up. As we finalize, I'm not sure if there are more questions, but as we end the evening with the presentations, I think really the goal was for you to put, for those of you who had not had a chance to meet yet staff, to put a face with a name and kind of like identify what each staff, what their role is, what they're working on. You might have guessed, but the why to the question why Marisol talked about both community courts and cultural events is that she's our magnificent elf who does a lot of work, as all of us do, but in addition to doing the case management for community court, Marisol is also the person behind the scene who always helps me with any cultural events and whatnot. Not that the other staff don't help, it's everybody really all hands on deck, but as you all know, and you've been part of that, it requires lots of details and organization. So thank you, Marisol, and boards and commissioners.
Okay. Would you like us to go to the last agenda item?
So yes, with that, board members, commissioners, I think the last agenda item, it's really other business and other announcements. I think we wanted to open this as an opportunity for you to ask questions from one another. I know there were some emails that I have received. Oh, I'm curious, how does the equity board work, or how does the human services, like anything that you would like to spend the last few minutes in asking one another questions or anything of that nature. Announcements.
I would actually want to direct this to someone in the equity board, whichever decides to answer it. As being one of the lucky people to help develop the board and present it to the council, how's it going?
I think it's going, as an equity board member, as a vice chair, I have to say that sometimes I'll just be transparent. Sometimes we get a little bit, and I shouldn't speak for everyone, so I'm just going to speak for myself. Sometimes it can feel a little bit as if we are spinning our wheels sometimes, but some of that spinning of the wheels needs to happen, because there's a lot of training that needs to happen. There's a lot of understanding that needs to take place in terms of how the city operates, how the different boards operate. So sometimes it feels that way. But then when I look back and think of the things we have done, and think of the things we have accomplished, that I'm very proud to be a part of the Equity Board. And I hope that we inspire other cities to create equity boards. And I hope that what you guys are doing from a behavioral health standpoint, I hope that that inspires the city of Seattle if they don't have something like that. So I think that everything that we do has value, has merit, has purpose. And yeah, that's just my take on it. I'm very excited about what we do.
Okay, we've got a board member up there. I'm sorry, I don't remember her name.
Elisa.
Elisa. You've got your hand up?
Yes, I just wanted to say, first of all, echo what Tony said, but also I think as sort of what Tony was indicating, progress sometimes feels slow, but that's necessary. And I think that the Equity Board is, certainly making very intentional progress. Mostly what I want to say is thank you to anyone who did help to establish it. As I read the news of late, there are a lot of other places, a lot of other cities and states who are almost attacking these types of initiatives. And I am just really grateful and proud to be in a city that is supporting DEI initiatives. So thank you for your efforts in setting the board up.
Well, I was really concerned that, working through this, that we really were trying to get out of the do as others are doing. And I was watching some of your board things, and I was really impressed with the thing you had with Paul with Right to Breathe, and I believe is Robert, was that, I believe his name was? From Right. Yeah, I was really impressed with that. And you get, at that point, you mentioned a framework. How's that coming? And, are you directing that to the council or city? How's that framework coming?
And actually, the board will have an update on that, the meeting in April from internal city staff from HR. But Pretty, you might have.
So we worked with Shannon Kelly Ray to kind of get it in a good enough shape where we thought it should be launched, and the city council approved it. And so I think now there's some work to figure out how best to train staff, county staff, or city staff to use the framework. It's a series of questions to kind of guide.
Great. Is the city staff still having equity meetings or equity councils? Do they still have those? Do they use the equity board to facilitate those?
Yes, they started implementing it in select programs. And I don't have more information on that other than I know City Council is receiving an update in the upcoming weeks, and the Equity Board will receive an update in the upcoming weeks. That body of work for the internal work, it's led by our Human Resources Department. So they have more information on that. But I know that they started implementing it, but there hasn't been a citywide training on it yet. So not each department has had a chance to implement it yet.
Manny, I was thinking about your question about how's it going. Ray Manahan's personal opinion, I feel like we had to take this first year like we're earning a degree to get educated on the many services that are out there for us to reference or really make a connection to. So thank you, Monica, for coordinating this event. This is so enlightening to hear all these things. If there's one thing that I really hope happens this year with the Equity Board is that we have more interactions with the community. We can only work in that room and meet once a week, but we really have to hear the voices directly from the people that we're trying to serve. So if it's a meeting with a group like the Baha'is who are here, or getting time with the school, or just walking the streets and just going from business to business, especially the ones that are of cultural significance. You know, that grocery store, the Indian grocery store on Front Street, or whatever. Just hearing them and to coming back and reporting that. And I think that framework that Monica mentioned is really going to help us set the foundation for that, because a lot of that referenced the ability for us to go out there and really have those kind of conversations and report it back to the group.
Thanks, Ray, because that was also my follow-up question was, are you engaging with the community? Because we did take a lot of time and effort into getting the community involved in that, so I'm glad you answered that.
I think Shay had her question, her hand up earlier. I'm not sure, Shay, if you still have a question.
Actually,
Or
Ray
comment.
actually answered part of my question when it came to how we've been engaging, because we are seeing a lot more people actually want to know more about the equity board. It was slow going at first, but we still maintain a full agenda every time we have a meeting, and we often we're starting to get more and more feedback as the process goes along, which is really exciting because I think for a while the community wasn't as engaged with us as they could have been, and now that engagement is growing. Not to mention with us being able to interact with people in person, it does open us up a little bit more to kind of gather more opinions about how we can be a better board and how we can serve our community in better ways, which is, I think, the most exciting part, because I dream of a time when at one point or another, people will automatically think of the equity board when they think about how they want to proceed with different plans and processes. And I think we're starting to see that currently.
And as I was listening to all of you, thank you so much, Shay. I would like to ask or mention two things, one question, one comment. One of the things is some equity board members said, rightfully so, it did feel sometimes that it was like spinning wheels and there was this learning and growing. And I'm also excited about the work plan for 2023. It is an exciting, very full work plan. Not only other departments are coming to seek input on really big projects, you know, whether it's capital improvement plan that recently the board touched on and will continue, or comprehensive plan, so really big projects for the city that are coming your way. Also, the equity board member identified 4 work plan items that I think are really significant. One on data tracking bias and privilege in data tracking, starting that work with the police department, working with businesses in the same similar bias and customer service, working on reporting bias or reporting hate and other different types of not necessarily crimes, but those where people can come and report an equity-related incident. So those are really big items that the board is tackling this year. So I think I'm really excited about that. But then the second thing that I wanted to mention, and actually it's a question that I was listening to Ray and all of you conversating, you know, as a staff who supports both boards, I often see or hear something on one board and I'm like, oh, this would be so helpful for this board, and the other way around. Speaking of community engagement, the Human Services Commission is embarking on this year. One of their major work plan items is to actually visit some of the nonprofit organizations and the work that they do that we fund. So that's a really good opportunity to really engage with the service providers, with their volunteers, with those that they serve. So really a lot of meaningful community engagement. I'm just putting out a question if there's an interest in others from the equity board to join and think about other joint projects. If you find them as an opportunity to grow naturally in that area, and that's something that we can look into in supporting you as staff. But I was, again, just wanted to throw that out because I'm like, oh, that's an opportunity. So something food for thought for later conversations.
And I wanted to throw something out. Has the City Equity Board had a joint session with the school district equity board. And is that something, I think that would be good.
Yeah, I think the equity board had recently someone from the school district staff present. We didn't, the discussion was not brought up for a joint meeting between the equity boards, but that's certainly something that the equity board can entertain and consider. So another great suggestion, Trish.
Thank you for that comment and question, Monica. I think my response to your question is that I would think that yes, absolutely, we should have a way to interact a little bit more frequently, so that if board members and or commissioners feel that there is something that we could do together, that there should be an avenue for us to do that. And I want to encourage you, Monica, and anyone in your staff, that if you think that the commission and the board could be working on something together, to please speak up, right? Like, I mean, I don't want things to just kind of sit somewhere in the back of someone's mind, because I know that we would do the same thing, right? Like, as things come up, we do bring it to the table. And so I just want to say, yes, please, if you know of things, because you are that pivot point, right? I don't know what goes on the commission anymore, but you do, right? And so do the other people who work in your department. So yeah, I would say a resounding yes from my point of view. Thank you.
Okay, thank you so much, Lucrecia and commissioners, board members. So any other questions, comments for the evening? I would call this first joint meeting a pretty good success. I think it was great, right? Okay, well.
Meeting adjourned?
In that case, meeting adjourned at 8:29, Trish. Thank you.